Hello, my name is Instructor Shane, and today we're going to continue with our patient assessment, and we're going to talk a little bit more about the O.P.Q.R.S.T and the patient assessment. So we initially talked about sample being kind of an acronym that we use when we're trying to get a good history of our patient. We like to use sample with O.P.Q.R.S.T in conjunction when we're determining our history, as well as what might be going on with our patient, both medical and trauma. I will tell you that we don't always use every letter, every part of that acronym. Sometimes we might only use on the O.P.Q.R.S.T, we might only use maybe onset and time, or maybe the severity and time and onset, but maybe provokes and quality and radiate may not be something that's pertinent to that particular case or scenario or that particular patient at hand. And as we go forward throughout this program, we'll teach you more about that. But just know these are breadcrumbs. Once again, these are guidelines for us to be able to adequately have a flow of how to assess our patients. And so in conjunction with sample, we'll use O.P.Q.R.S.T. It's very important that you memorize these acronyms. So typically with O.P.Q.R.S.T, O.P.Q.R.S.T is generally used to manage or get a good assessment of somebody's pain level, but it's not always that. Don't just think it's just pain management that we're trying to assess. We can use this in conjunction with any kind of a medical case or any kind of a trauma patient. The O stands for onset. Now, a lot of times new providers will think that onset is the time. But in reality, onset, what we're trying to figure out is this an acute onset or a gradual onset? And why that's important, acute onset means it's something that just happened all of a sudden, and they were fine a few minutes ago, and now they have an emergency that just happened. Whereas a gradual onset might be something that's been going on for several days or several months. It doesn't necessarily mean they're not having an emergency. However, it clues you in to know that this is actually a progressive problem, and it gives you an idea on the acuity or the severity of that problem. And then simply just asking them, saying to the patient, did this just start, or has this been going on for a little while now? And if they say, no, it's been going on for a little while, get a sense of that. Well, how long has that been going on for? And that's where the time comes into play. So understand that initially when you begin to learn these acronyms in this assessment, I expect you to kind of go in order until you get a flow. Once you get a flow and you realize that we're essentially just humans taking care of humans, we're essentially just trying to have a conversation with another human being and try to get an idea of what's going on with that patient and to provide good quality treatment and medical care to them, you'll actually be able to realize that you're skipping around a little bit, but you're still gathering that information. All right. So we'll proceed on here. So provokes is P. Basically, you're going to ask the patient, does anything make it worse or better? You know. So clearly, if somebody has an injured arm, they might say, yeah, it's worse when I move it. Okay. Well, what makes it better? Well, when I don't move it. You'll learn about some breathing problems as we go through. Certain patients with certain medical conditions, their medical conditions will get worse if they lay flat, right? And better when they sit up, okay? And so forth. So what makes it worse? What makes it better? That's provokes. Quality. This is something you want to be very careful of. You might hear people talk about quality as stabbing, burning, and sharp. You don't want to, as a provider, lead the patient into asking that question. Meaning, so if I had a patient that had abdominal pain, I am not going to say, is your abdominal pain sharp or dull or burning? No, I'm going to ask them, hey, describe it in your own words. Tell me how your pain feels like to you. Let them be the one to do that. And if they can't describe it, that's okay. That's how they describe their pain. All right? At the end of the day, you want them to tell you how that pain feels. You don't want to lead the patient into how that pain feels. Don't give them any clues on that. Let them tell you. Radiate. Does the pain move anywhere? Or does it stay there? You're going to learn from different medical conditions out there like appendicitis and some other conditions where sometimes the pain can move or radiate somewhere. And so I simply just ask the patient, does the pain move, or does it seem to stay right there where you're at, where you're pointing at? And then severity. Severity is a pain scale. We use that Wambach pain scale of 0 to 10. 0 is no pain, and 10 is the worst pain you've ever had in your life. And that's exactly how I would ask it. Whenever I approach a patient, I'll say, hey, on a pain scale of 0 to 10, 0 is no pain, and 10 is the worst pain you've ever had in your life. Give me a number of how you'd rate your pain. The higher the number, the worse the pain. And they'll describe that to you. And now, this is also a little bit of you've got to use a little bit of what I call spidey senses. You got to be able to look at a patient, and if the patient is as calm as I am right now, and I'm saying, yeah, my pain's a 10 out of 10, you kind of have to be able to interpolate that that's a 10 out of 10 for them, but it may not necessarily be an actual 10 out of 10. However, you might have a patient who has a bone sticking out of them, and they're going to be like, yeah, that's a 10 out of 10. And clearly you can see on their facial expressions and their body language that that's a 10 out of 10 on the pain scale. Okay, so you have to kind of interpolate pain scale a little bit, but also remember this is their interpretation of that pain scale. And again, time. Time is when did the pain start? Like what time? Did it start at 7 a.m., 9 a.m., 3 months ago, 3 weeks ago, and that kind of thing. And I would simply just say to them, hey, when did your pain start? Or when did, what made them call 911? You know, they called 911 for a sore throat. Okay, well, when did your sore throat call? When did your sore throat start? What day did it start, or what time did it start? Or whatever they called 911 for, whatever their chief complaint was, you can use time on the O.P.Q.R.S.T and get a sense of how long that's been going on for. Okay, that concludes my lecture on O.P.Q.R.S.T.